Hi, my name is James Harris. I'm a general surgeon working for Johns Hopkins at Howard County General Hospital. So to repair a hiatal hernia, it's done most of the time laparoscopically. Patients do stay overnight in the hospital afterwards, but what we do is we make 5 little incisions, and the biggest one is usually about the size of my thumbnail, about a centimeter. The other incisions are about the size of an eraser head, about 5 millimeters. I go in there laparoscopically, meaning with a camera, and we use special instruments through the little incisions to first take the stomach out of the chest and put it back in the abdomen where it's supposed to be. There's a lining along the abdominal wall called the hernia sac, which we also take out of the chest and put it back in the abdomen. We often have to remove part of that. After we have the stomach back in the abdomen where it's supposed to be, we then have to put sutures in the diaphragm where the hole is, that's the hernia, and we close the hole up and we make it snug around the esophagus so there's no room for anything else to go back into the chest. We then take a type of mesh, it's called a biologic mesh. It's a mesh that the body eats up over time. That mesh, we put it around the area where the hernia repair was done to take the tension off of those sutures so it doesn't rip apart again. After we've secured the mesh in place to take the tension off of the repair, we then finally do what's called a Nissen fundoplication, or a wrap. The wrap is the part of the operation that helps prevent the reflux from happening. We basically take the top part of the stomach and we wrap it around the esophagus, and that's what kind of serves as like it's like a sphincter around the area of the esophagus, and it stops reflux from coming up. Over 75% of people after they have this operation done, they're able to stop all of their medications, come off of the proton pump inhibitors like Protonix, Nexium, things like that. So most people do fairly well after the surgery when it's done laparoscopically because there's no big incisions. I do insist that there's no heavy lifting for 6 weeks after surgery. The reason why is there are those sutures that I put in the diaphragm, and if they were to strain themselves, they could rip those sutures and the hernia could come back again. It takes about 6 weeks for the peak scar tissue formation to develop, and in the meantime, it's just my sutures holding everything together. So even though they may feel like they could do what they like before then, I insist that they don't do any heavy lifting for 6 weeks after surgery. Most people feel like getting back to all their normal activities after about a week, so I always advise taking about a week off from work and a week off from driving. People could walk as much as they want after surgery, they could do stairs, they could do all the normal things that they like, but they will be sore for about a week. So it's always a good idea not to put any type of important meetings or anything ahead of their operation. Unfortunately, hiatal hernias do recur. There's a very high recurrence risk. When you look at all comers who have had a hiatal hernia repair, there's up to 40% chance it could come back again. Now, that's all patients, people who had mesh, who didn't have mesh. So there's a lot of different things we do to try to decrease the risk of recurrence. We do place mesh in every patient if we do have a hole to close up. The mesh does go away with time. It takes the tension off the repair, so it does help decrease the risk. We also keep people overnight to allow them to recover without the risk of possibly throwing up after surgery, because every patient that I operate on, I leave a nasogastric tube in overnight until the anesthesia is worn off. So the risk of them retching and throwing up right after surgery is very low. Retching right after surgery puts a lot of tension on the repair, and there is a possibility of having immediate recurrence. So those are 2 things that I do to help decrease the risk. And of course, I do set the lifting restrictions for 6 weeks. My personal recurrence risk is lower than 40%, but I do quote patients with what the data shows. There's a very high risk it could come back. Now, that being said, of the 40% of people who do have a recurrence, only about 25% have to go on to actually have another operation to then repair the hernia. And that's the reason why is because the symptoms are typically not as bad and they're able to manage it with medication.